Evolve. Evolve is a health tech platform where we're helping the patients on reversing the disease called diabetes and all the other chronic diseases like hypertension, along with the management also. As we know that diabetes is such a silent killer that if it is staying in our body for a long time, there's a possible chances that we may end up having the complications. So let's, in this journey of discussing the diabetes, we have our esteemed guest, Dr. Nishita, who is having 8 years of experience as an internal medicine doctor. And she has been dealing with the diabetes patients and their complications day in and out. So today we will have our knowledge sharing with her on what exactly diabetes complications are all about. How do we really get to know? How do we really have to stop that it should not go into a bad stage? And how we can really prevent these complications. So, Dr. Nishmita, welcome to this session. Today, we are very, very happy and elated to have you on our panel. Dr. Nishmita, there are a lot of patients who will be asking you these questions into your OPD also. So I'll start on their behalf to ask you one by one.
Yeah.
Right, doctor? So
Thank
can
you,
we start
Dr.
with it?
Bhawna, for that. Yeah.
So doctor, as we know that diabetes is spreading like a vast disease in India, right? Everyone in India is somewhere is affected with the diabetes in the family or maybe never known people. And people take it, it's nothing to be worried that we can just pop in the tablets and probably its sugars are controlled. But I believe that it is a very, very serious issue. It should not be ignored. So my first question, which is being generally asked, that what is uncontrolled diabetes? Or what are the indicators or marker to know that my sugars are absolutely out of control?
Correct. That's a very good question. If you see generally, every person that we know knows one or the other person who is having diabetes. It is that rampant nowadays. So we see that India in the coming days will be touted as the diabetic capital of the world. Okay. So initially, the third world countries that we are a part of, we were known to have much of this communicable diseases as the main problem. But right now, what is happening is we can see a gradual shift in the non-communicable diseases, mainly diabetes, hypertension, ischemic heart diseases. All of these are becoming the forerunners of what can possibly kill people in the coming decades. Okay, so that being said, uncontrolled diabetes takes the cake, in saying it turns out to be the major killer in the coming days. So what is uncontrolled diabetes? Uncontrolled diabetes is when, to speak clinically, when your blood sugars are over the range of 180 mg per dl. Okay, 180 mg per dl when you're taking it randomly, if you're a newly diagnosed person. So they come up with symptoms like polydipsia, that is increased intake of water, polyphagia, that is increased intake of food, or polyuria, wherein they will be having excess urination. So all these three symptoms, when a patient is having, that might be the first indication that they are going for a uncontrolled sugars kind of a situation. Okay. Right. So this is in a newly diagnosed person that I'm speaking about.
Okay.
So if we take people who are known diabetics, in them uncontrolled sugars can come up with similar symptoms, but they might also have symptoms like dizziness, blurring of vision that can ensue due to the complication of diabetes, which of course we'll be talking in the coming segments.
Okay. So doctor, one understanding which I had from the discussion is that anybody who is newly diagnosed diabetes definitely will have more of a food craving. That means the hunger is going to be a constant symptom for them, right?
Yes.
Along with that, the you said the frequent urination and the frequent water intake, right? So this is the thing. All right. So doctor, the second thing, that what is the commonest complications that we see in the diabetes, which is not known to the people to take it very seriously? So what is the one common complication which is ignored by the people and it should be taken very seriously?
No, we cannot say that there are just one complication that has to be seriously taken. Most of the patients that present to me think that diabetes is not a major illness, because even if you skip your medicines, even if your sugars are over 200 for a long period of time, the patient themselves will not keep on experiencing any symptoms which will tell them, okay, that this is, we are reaching a dangerous point now. There is no indication till, the major damage is already caused in the body. So in that point, we can majorly divide diabetes into two complications, that is the immediate complication and the late complications. Okay, in the immediate complications, which the patient will obviously come to know, are hypoglycemia and hyperglycemia. Okay, so the hypoglycemia is when the sugar levels come down below a certain set point. It again depends on how well your sugars have been all this while. And hyperglycemia is when, the sugars go to a point wherein there is something called ketones that are produced in the body. Okay, these ketones will cause something like an acidic situation in the body, which causes giddiness, coma, blurring of vision, all of these symptoms. So these are the immediate complications. When we go to the late complications, which in the most time the patient is not aware of, they will have again microvascular complications, which affect the tiny arteries in the body, and the macrovascular complication. The microvascular complications usually affect eyes, the legs, okay, in the term of retinopathy and neuropathy. In macrovascular complications, we have symptoms like heart attack, stroke, these complications. So there is not one complication that I should say that the patient should be careful of. These are the things that they have to be aware of, that over a period of time they will be affected by it. But definitely the sugar levels are something that needs to be kept in check to control all of this.
So doctor, what are the normal investigations that we advise to the patient to know that your sugar levels are fluctuating or it is into a bad situation right now? So what are the common tests that we generally advise the people to take it, at least to know that you are going towards neuropathy or retinopathy as you just recommended? So what are the tests that we should be advising the people?
So in terms of, again, we have like type 1 diabetes and type 2 diabetes, right? So in type 1 diabetes, we say after the detection of type 1 diabetes, they'll have to get certain tests done after 5 years. That is a recommendation in type 1 diabetes. In type 2 diabetes, we say that, most of the symptoms would have been for some years and there has been a delay in detecting. So at the detection of type 2 diabetes, we usually, so I was saying, I'm sorry. So it's saying that FBS, PPBS and HbA1c are the common tests that most of the lay people also know about. Apart from that, we have to check for microalbuminuria in the urine. Okay, it tells us about the protein that is leaking from the body, which is further an indication of nephropathy. Also, urea and creatinine are something that we keep a watch on. Along with that, there are certain tests for the foot to check the sensation, and also for the eye, we recommend a fundoscopy. Again, it depends on type 1 or type 2 diabetes, how frequently we advise it. So at least one yearly is the least, okay? And in people who are known to have complications detected in this yearly test, we ask them for more frequent follow-ups.
So doctor, is there any way that the complications can be prevented? Or if there's any solution, because a lot of patients are on the medications for a long time. Still we see that, they are developing some of the symptoms. And it's like being a long-standing diabetes, or it can happen even in a short span also. Because we really do not know what exactly went wrong with the patients, because they say that we are following everything. So just wanted to know from your end that what is that missing factor which leads them towards the complications and how that can be avoided.
Okay. So one thing is definitely glycemic variability that the patient does not consider. What they do is they check their sugars, say once in a month or once in 6 months, and that day they find that their sugars are normal, and they have a inkling that okay, nothing will go wrong with me because my past medical checkup has shown up that the sugars are within normal limits. But what actually happens in the body is there is something called glycemic variability or glycemic fluctuability. So wherein we see that the sugars sometimes go very high, sometimes they go very less. Okay, so this sort of fluctuation causes something that we call endothelial damage. Okay, this endothelial damage in turn leads to all of these complications. So the glycemic variation has to be controlled. That means the sugars have to be maintained at a constant, controlled level throughout, so that any further complications can be avoided. And also this has to be done by, the frequent checkups, initially at least, because our body has something called a metabolic memory. Metabolic memory, or the legacy effect, is what we call it.
Okay.
So in this, the body remembers how well your sugars have been controlled. So to tell it in very simple terms. So initially also, if you have a period of well-controlled sugars, the chances for the complications happening comes down very significantly. So if I have to say it in a nutshell, you have to prevent glycemic variability to avoid further complications.
Okay. So, doctor, one very important question which you were talking about, that people go into a diabetic coma, right? So, is it something like, if you have a diabetes for a long time, can it land up into a fatal attack also?
Definitely, you can say that. Not just long-term diabetes, it is basically long-term uncontrolled diabetes. I know many people who have had diabetes for a very long time, but the sugars have been so well controlled that, the diabetes just becomes a part of life, and it is not even considered as a disease because you've been, keeping your sugars in extra good control. But what happens in some people when their sugars are uncontrolled over a prolonged period of time, and body is subjected to any sort of stress, metabolic stress in the form of infection, dehydration, or any stressful events, there is production of ketones in the body. So this causes, a acidotic state wherein the patient has breathing difficulty, altered sensorium in the sense they lapse into a coma, wherein, all of this together can even lead to the death of the patient if not picked up in the initial stages.
So can this be avoided somehow by the patients, like beyond the medicines, what all they should do to manage this diabetes or to keep it into a control? What is your general suggestion to the patients?
Yeah, so general suggestion would be, first of all, to get yourself educated with what exactly the disease is. Okay, because it is not something that you just avoid putting 1 cup of sugar into your tea so your diabetes is managed. It is not like that. It is a metabolic derangement that is happening in the body. So when I say metabolic derangement, along with it comes a lot many diseases. The diabetes is just the tip of an iceberg. We can say even the hypertension, ischemic heart disease, these are not far back. It is an indicator which people are aware of, that diabetes is, there is something going wrong with the body. So the better you realize it, the easier it would be to control any future complications resulting from that. So that being said, there are one major spike is a lifestyle management, wherein platforms like Zibov have been doing a very good job in educating the people as well as in bringing the lifestyle back under our control. So basically it would involve diet, wherein, the carbohydrate counting is done, or there is a diet wherein, you try to metabolically heal the body and get it back to its previous non-diabetic state. Okay.
All right.
There are food that can help us achieve this. Also, there is exercises basically in the form of resistance training, balance training, and cardio activities. The recommendation is around 30 minutes of brisk activities every day for at least 5 days in a week. This is the recommendation that we get from ADA.
All right.
So yeah. And along with it, medicine also plays a very important role. We cannot negate the role of medicines in all of this. But the more people get educated that at the initial stages of lifestyle management and medical nutrition therapy, only diabetes can be controlled in many of the situations. But since people are not aware of that, they end up going on long-term medications, insulin, all of those. So that is when the real trouble starts in the term of compliance.
All I understood from the discussion, doctor, that the diabetes complications can be avoided provided the patient follows the correct medications on time, be aware of his health situation, keep on checking the regular sugar levels, keep on monitoring the complications, and also follow the lifestyle changes, which is compulsory for the patient. It's not by a choice, but it is a mandatory to control the sugars and avoid the complications. So thank you so much, doctor, for your wonderful sharing of your thoughts. And we are very, very elated to have you on this forum to discuss with it. It's a pleasure to have you, doctor. Thank you for your time. And
thank you,
hope
Dr.
to catch
Bhawna.
you soon. Thank you.
Bye.
Bye, doctor. I'll call you.
All right.
I'll call you after this.
Okay.
Thank you so much for giving your time, doctor. I'll just record this. Yeah. Thank you.
Bye.
Bye-bye.